Hey, good evening, everybody. My name is Dr. Andrew Rupp, and I'm looking forward to spending some time with you all this evening. So I am here hanging out in my living room, which is nice. I'm at home, didn't have to leave the house for this. And the reason that I'm here is because this is the exact spot that we shared a lot of our pregnancy journey. Because we're going to be talking about pregnancy tonight, if the title didn't give it away, hashtag pregnant life. And we come at that from a few perspectives. One, we are just 2 months, 8 weeks tomorrow removed from welcoming our second little man into the world. Baby Zion was born on January 23rd. And if you have been a fan of Thrive for a while, if you followed us, you knew that a lot took place right here at this spot, on this couch, on the previous infamous orange couch that lived before it. And we very openly chronicled our pregnancy journey in what we called the bump dates. The bump dates still exist, both on our Facebook page as well as on the YouTube channel. So if you ever have such a desire, you can relive our pregnancy alongside with us. And what you'll realize and what you'll see as we lived it, as well as what we get to see with people every day in the office with the pregnant moms that we take care of, the pregnant life is not always a glamorous one. Everyone talks about the pregnancy glow, but they don't mention it's just greasy faces from sweating all the time. The reality is pregnancy is such an amazing, beautiful transition and one of the most incredible things that our bodies are capable of, but it's not always fun. I know there are certainly people that love being pregnant. They think it's the most special thing, but we talk to so many moms that don't really enjoy that they struggle because sleep, as you know, if you're an expecting mom listening this and hanging out with us, sleep is not the same. Whether it's just the extra stress and extra noise going on in the background in your brain, things that you're thinking about, or the reality that you can't really be in the same positions that you used to be, that you've got pressure on the baby, pressure on the belly from the baby, you've got different concerns with blood flow, don't stay on your back too long, you can't lay on your belly because you got this big lump. Sleep is not the same for sure. Another thing, stuff just hurts. Why does everything hurt during pregnancy? Your back is achy. You've got maybe pain shooting down your legs. The front part of your pelvis hurts right around that pubic bone. There's pain traveling down the inside of your legs. The hips, the upper back, everything is just painful and not feeling like it used to. Energy kind of goes down the tank as well, doesn't it? You don't really have the ability to maybe be as ambitious or be such a go-getter. I was talking to some of the pregnant moms that we care for in the office recently, and they're like, I used to be so productive, I used to get so much done, and now, 30 plus weeks pregnant, you lift a box or you move your active for 20 or 30 minutes and you're wiped out for the entire day. Pregnancy is a joy, but it is a struggle. If you are welcoming your second child into the world, or third or fourth or anything beyond that, you have the extra challenge of chasing around a little one. Now you've got a little baby or a little toddler or a little something that is demanding more of your time and attention than it did the first time around. I know that was a huge thing for us, as you remember back from all those bump dates, that pregnancy number one and number two for our family was way different because we got crazy man Zeke, toddler, big 2-year-old to take care of, and he's got lots of energy, and pregnant or not, he's demanding and needs a lot of attention. Maybe this isn't, your second, third, fourth kid, but it's your first. That brings its own set of challenges. There's uncertainty. There's some fear surrounding pregnancy. There's maybe just a lack of support. You don't feel like your birth team or your spouse or partner or whatever understands what's going on, or maybe supports your wishes and your desires, or maybe you just don't even know how to accomplish the sort of birth that you want. All that to say, pregnancy, as beautiful and as amazing as it is, sometimes is not entirely enjoyable. What I'd love to hear, if we've got any of our expecting moms tuning in, is what are some of the weirdest or most frustrating pregnancy experiences that you've had? Because I know having that baby bump is a license for any random stranger in Target or Starbucks to come up to you and either touch or rub your belly, maybe ask questions about how far along, boy or girl, names. There's so many liberties that our friends and unknown solicitors take when you're expecting. So if you have any interesting stories, please share them with everyone else, and we'll check them out in the comments here. But the question I have for everyone tuning in for our Pregnant Life webinar here is everything that we just talked about. all the frustrations and struggles that come along with pregnancy. Is that as good as it gets? Is that status quo? Is that all we can ask for? Or is it possible that there is a better way? So that's what we're going to be looking at and addressing here tonight, is maybe if we can have an upside to that. Weakened pelvic floor. Yeah, I see some comments here. That's definitely a big additional struggle, is especially if you're an athlete, if you enjoy working out, you have to learn to breathe differently. You've got the whole thing of, laughing and you pee a little bit, or box jumps or jump rope, and now you've got urination challenges. Add that to the list of pregnancy struggles for sure. So that's the question we're going to ask, is what can we potentially do so that this is less so the norm than it used to be? Before we even get to that, let's talk about why pregnancy has all these challenges. One thing that we've got to mention that some of you may be familiar with already is this hormone called relaxin. So relaxin is your best friend, because you want to have as much relaxation in your ligaments and joints and soft tissue structures when it gets to that childbirth process. And that's exactly what relaxin does. It's a hormone in your body that loosens things. So instead of certain joints being really stable and locked together, things are a little more stretchy, a little more open. And I'm going to use our little friend here, the pelvis. This is what you've got on the inside here. The front of the pelvis is what's looking at you. The back is towards me. And this pubic bone up front, see how that opens up a little bit? You want, it's a little bit of a better view maybe, you want that opening. Those little millimeters and centimeters of movement makes the world of a difference when you're letting baby pass through the birth canal. And so relaxin is great, but the downside of that hormone is you're just more unstable. Things are loose in your body. Areas that were more, structurally sound and didn't have issues before start to have that show up, because you just don't have as much holding you together as you used to. So when we combine that with the fact that we've got a growing belly, we've got a big shift in our center of gravity, we start to have some problems and some challenges. So what happens when belly grows, your weight shifts more forward, and you can kind of visualize, and you live it every day if you're 20, 30 plus weeks, as that pulls you forward, your back arches, your pelvic tilts, and it adds a lot more stress and strain on that low back, mid back, all the way up through your neck. Because if you're on your feet for a while without proper support, without proper motion and stability, you're feeling it. You're not feeling like $1,000,000. And just like you said, Jennifer, in the comments there, your back pain is worse this time than the first time around, probably because you're on your feet a lot more, chasing around little ones. Plus, every pregnancy that goes on, as much as your body does bounce back and get back to a new normal after birth, it's not always exactly the same as what normal used to be. And the next time pregnancy comes around, it's quicker to make those changes. It's quicker to loosen up. It's quicker to have relaxin do what it does as well. So we've got this combination of relaxin, loosening ligaments and soft tissue. We've got a growing belly that's shifting weight forward and creating pressure on different areas of our spine, making our hips adapt differently. And we've got the fact that your body is working overtime, just growing a baby, right? That takes resources, that takes neurologic and literally energy from your body. If you think about just a simplistic analogy, say you wake up every day with 100 units of energy internally, typically your body disperses a good bit of that just to the automatic functions, right? There's digestion, there's immune system. If you exercise or work out, that's going to burn a lot of that extra energy. When we've got a baby growing, that is a huge energy pool and a huge drain on our resources, and you don't have as much to go around for everything else, which is part of the reason why your immune system, you're more likely to get sick during pregnancy, and contributing to that exhaustion that we talked about earlier. So let's see if we have any comments there. So we've got this challenge of relaxing, loosening things, center of gravity shifting, and we're leading to all these changes of back pain and hip pain and sleep challenges and so on. So we got to answer the question, is that as good as it gets, or is there something that we can do about that? Well, that is 100% where our role as prenatal chiropractors come in. So like I said, a lot of you know me from being friends of Thrive in the page here, but if you don't, let me introduce myself again. I'm Dr. Andrew Rupp, the owner and the chiropractor at Thrive, and prenatal care is our world. That's our focus and specialty, along with taking care of kids and little ones. And one of the things that I've pursued and done along with that goal and that focus of prenatal care is something called the Webster technique certification. And the Webster technique is a specific method of analyzing and adjusting people specifically for pregnant moms. So that is the approach that we use with every one of our pregnant patients that we care for. And not only is that the clinical care and the clinical framework that I operate from, but honestly, if you've been in our practice, I'm sure some people listening here can chime in and agree with that it is focused on family life and pregnancy life. You'll see every single room has toys in it. So if this is your second pregnancy, your third pregnancy, and you're not coming to the office alone, you're coming with little ones in tow, whether or not they're getting adjusted as well, they're more than going to be able to entertain themselves because we've got lots of fun around. We've got nursing, a little separate nursing room, nursing nook for moms that has a changing table in there with some extra diapers stocked. We've got one of those stinky, what do they call them, diaper genies or diaper pails where it locks the scent in. It does do a pretty good job of holding the smell, but I will be honest, by the end of the week and that thing needs emptied, if you don't get the diaper in and out of there quick enough, you are going to catch a whiff of some not pretty scents that take place during the week. Basically, please know that our office is built and designed and catered around you as an expecting pregnant mom with a family. So not only is the care that you receive going to be different, coming from that Webster technique prenatal focus, adjustments are going to be very gentle and specific. Our equipment, literally the tables and the pillows, accommodate you and your needs. You're probably wondering, maybe you've been to a chiropractor before, but now you've got this big belly. How in the world are you going to lay down? How are you going to be able to get adjusted? Well, that comes back to the equipment and some of the resources we have that make it so easy, so comfortable for you to be able to get relaxed when you're laying down. And every single time a mom lays on her belly on the table, she's like, oh my gosh, this is the best, because it's the only time you get to lay on your belly during pregnancy, right? You can't do it at home on the bed or anything anymore just because you've got little one in the way. So our pregnant moms love getting adjusted because it helps correct and address all of these challenges that we're talking about. So yes, the relaxation still exists. Yes, that growing belly is shifting the weight forward and creating more stress on those joints and that spinal structure. But what we're able to do with care and with our specific adjustments is restore balance to your spine, restore balance to your nervous system, correct those misalignments that are causing you so much pain and discomfort, and allow you to not be feeling so miserable. And I'll share a few stories here in a minute of some of the pregnant moms that we've taken care of during the last couple months and some of the relief and improvements that they've seen. But one other thing that I want to touch on before we wrap up here is the fact that this is such an important topic, not just for you as an expecting parent, but for your little one as well. And you might not think, taking care of yourself during pregnancy here has any bearing on birth or anything beyond that, but I am here to tell you that it 100% does. Without getting too much off track and on a side tangent here, the kids that we take care of in the office, whether they're dealing with nursing problems or chronic ear infections or ADHD and immune system challenges, time and time and time again, we can trace that really start of those issues back to the birth process, back to how they entered the world. Did it go smoothly? Was mom and baby able to be in control and call the shots and have a process that they wanted to have? Or did we have interventions leading to maybe pulling and twisting and tension on that very delicate, very important area of the head and neck for our little ones? And so what we found through years of collective experience is that when there's a lot of birth stress and birth injury, it leads to sick and struggling and hurting kids. So by taking care of yourself now, by helping the pregnancy and specifically the labor and delivery go more smoothly, you're not just helping yourself, you're helping your little one have the healthiest start to life as well. And to explain a little bit of what the Webster technique and what we do could relate to how a baby is entering the world, I'm going to bring back our trusty pelvis model again. So just to reorient and explain here, front of the pelvis is facing you, back is towards me. So our little boy or girl is sitting right up here, hopefully nestled with their head cozy in that pelvis. And when they enter the world, got to come out through that birth canal like that. So we've got this nice, even, balanced canal here. And that's what we should see. We should see nice open circle. But take a look. If we have what we call a fixation or a misalignment, if your pelvis isn't moving properly, if it's stuck a little bit, what takes place here? That canal changes drastically. We no longer have a nice, open, smooth pathway. We've got less space for baby to enter the world. And any of our expecting moms who've had a pregnancy and a birth already will tell you that during that pushing and labor process, you want every spare millimeter and smidgen of a room that you can have, because it's a tight squeeze, right? It's not an easy process bringing a little one into the world. But what we're able to do through that Webster technique is make sure that your pelvis is as close as possible to that balanced state. So not only is that going to help birth, what we often see as well is that baby's actual positioning during pregnancy will improve when mom is getting adjusted. So as you can see, again, baby sitting up here, when there's twisting and rotation in the pelvis, not only is it going to affect that birth canal, but there's a lot of ligaments connecting the side of your sacrum here up to the uterus. So if we just visualize our baby up here, and when that's twisting, it's creating abnormal pulling and tension and twisting on the uterus as well. And what that leads to is, just like if you took a balloon that was kind of partially pumped up and twisted it, there's going to be less space in the middle, or differently shaped space. Same thing takes place in the growing baby belly as well. So what we're able to do is, through a combination of the adjustment, balancing out that shift in the pelvis, and then we do some work on the round ligaments and the psoas muscle, which are in the front of your belly there. If you've ever felt that shooting pain down the side of your belly towards the front of your pelvis, that's the round ligaments. Through some care and some work on those, it's able to release that tension on the belly, calm all the stress and the strain that it's feeling, which means baby has the room and has the ability to get in the position that they deem best. So that it's really a decision that's not just for your own sake and for your own benefit, but it's really helping your little one have the healthiest start to life as well. I promised some stories, some of the moms that we've cared for recently. Let me share a few of the things that we have experienced just recently in the office. Multiple pregnant moms recently who've come into us starting care, maybe because there were some minor challenges, but mostly just wanted to have a healthy pregnancy and maybe not sleeping so great. The thing that we've been hearing so much recently is, oh my gosh, I've been sleeping so much better since I've started to get adjusted. And that's because partially there's less pain, there's less tension in their body, so they're able to be at ease. And especially when we are making corrections in this top part of the neck, that helps calm stress in your brain and your nervous system, which is going to allow sleep to kick in, which is going to allow your body to get to that relaxed brake pedal state a lot easier. So we've been hearing so much that patients are sleeping better. One of our moms it's her third time around, third little one entering the world. It's got two little crazy toddler boys that are a handful. And even with that, even chasing around those two little ones and having a third pregnancy here, she said this has been the easiest one she's had by far, because she's getting adjusted for the first time. And her body is just feeling so much better, even though she's running around and so much busier than before. We've had moms who, maybe they met us at 30, 32, 34 weeks. By the end of pregnancy, at that 39, 40, 41 point, they're saying, hey, I feel better at this point than I did when I first met you. And give me some help here, expecting moms who've been through a pregnancy one or two times before. How does at 34 weeks compare to 40 or 41? Usually those last month or two, really that last week or two, it escalates dramatically, where you are just feeling like crap, you're sick of being pregnant, you're ready to be done. And we've got the opposite. We've got people telling us that at that end game, they're feeling great, they're feeling as good or better than they did 2 months ago. What else? We've got, I can think of a patient who, it was, I think, mid 20 weeks that we met her, and she was at a point where, she's riding the scooter around the grocery store because there's so much pain shooting down the inside of her leg and in the low back. By a couple weeks, month or two later, she was ending the last few months of pregnancy, so much more active, walking around easily in a completely different state. I remember we had a mom who was really stressed and worried when we met her that she couldn't really take care of her toddler. She was, I think, 24, 26 weeks along, had a little 1-year-old who's crazy, running around, getting into stuff. She could hardly walk up and down the stairs. She didn't feel like she could really care for him, and she still had months left of pregnancy. Started getting adjusted, started doing some things to help her body be more stable. Last few months of pregnancy were so much better, so much easier. She felt like she could actually be a mom still, because life doesn't stop even when you're pregnant. It would be nice if it did. Last story that we could go on for the rest of the night, but we've had multiple moms now even come in with a breech position, which means that the baby's head Instead of facing down into that birth canal, it's facing up with the butt or the feet towards the bottom. Fed moms come in like that, or in a transverse position, which means instead of the baby head down, they're lying sideways across the belly. Neither one of those are optimal or ideal positionings. But through getting adjusted, through balancing out with the Webster technique, like we were just talking about, they get both relief from the pain and the discomforts that they were feeling, as well as changes in how baby's actually positioned, leading to head down, easier birth process. And no one wants to go the route of a C-section because there's so much longer recovery. There's so many things we miss out on when baby doesn't pass through the birth canal. And so they were able to accomplish that ideal dream birth that they wanted. So that's the reality. Is it's not just for you, mom. It does make a world of a difference for how you're experiencing pregnancy, but it's for your kids as well. It gives them the healthiest chance at having a great start of life. That's why our dream world, our ideal world, is a mom who's supported and empowered through the proper birth team and proper resources throughout pregnancy that lets her have the ideal, relaxing, calm, peaceful birth that she wants. Then that newborn has the healthiest chance at a great, thriving start to life as they can have as well. So that is what. That's why we're so passionate about pregnancy, because we get to hear stories like that all the time, and that's what we really feel like every mom deserves. There's so many things, there's so many questions you have during pregnancy, though, and that's what we want to be. We want to be a guide for you. We want to be able to point you towards resources like a doula, prenatal massage, prenatal yoga. We love, salt power yoga up here, stray dog yoga down in Wexford. There's so many great options we have. Nutrition is a huge thing. Those are important topics. We've covered those in different settings, so if you want to learn more about what the role of a doula is or what some of those other pieces of the pregnancy team might be, please go back on our page or send us a message. We'll get you the link for our Baby Bumps and Beyond webinar that we did a few months ago. That's where I really talked more in depth on some of those outside things. But the point is, those are difficult waters. And honestly, what we want to do as much as anything for you is be a guide, be a resource, be able to point you and connect you towards amazing doulas and amazing resources so that ultimately you can have the ideal birth and the healthiest start to life for your little one as possible. So please use us as a resource, use us in any way that we can to help. The thing that I really hate hearing down the road and that we hear all too often is some sort of regret. Maybe it's when we're talking with mom in her second pregnancy, or maybe we're working with the kids, and inevitably, that birth process comes up during our history. And I hate hearing parents who have regrets saying, I wish I would have known that there were different options. I wish I would have been getting adjusted then. It hurts because there's nothing you can do at that point. You can't go back and change it. You can't go back and relive those decisions. And that's what drives us to share. That's what drives us to do stuff like this, to make sure that people have options and people have information so that they can make the best choices that they can for their families. So if we can help you, if we can be a part of that prenatal chiropractic world for you, if we can help be a guide in finding the right birth sources and birth team, please reach out and schedule something. The best way to do that is just giving the office a call or sending us a message on here. And what you can expect with that process is the first thing to be a complimentary consultation. And that is a no pressure, simple conversation to just let you know what to expect with our office. We're going to cover, what we do and how it's different than traditional chiropractic approach. We're going to cover what you might expect for our care plan recommendations, what sort of costs might be involved, everything that you might want to know coming into care before you're investing time and money into an exam. And please mention that you are a guest of this webinar as well, because we're going to make sure that you get a $50 gift certificate that takes $50 off of the cost of that initial examination process. So reach out, schedule a call, and we're looking forward to helping you have a better pregnancy. It doesn't have to be that status quo, that normal of crappy sleep and exhaustion and back and hip pain that is so common. It can be better for you. So thank you for tuning in. I look forward to meeting you in the office and helping you and your family thrive.